Hello there. Welcome to my show, COVID-19 Update by Heerak. Today is October 8th, 2020, and today is World Sight Day. Hope in sight. Um, yeah, so you should vote for Heerak on November 3rd, 2020 to make America safe again. You know what Jesus said in the Gospels? They have eyes, but they do not see. They have ears, but they do not hear. And that may be the theme of COVID-19 America. Yes, COVID-19 deaths are spiking up, as I've said. The third peak in United States of America is from September to December, and we're going to have a lot of people die. Um, so we're seeing spiking up of death in every area in America. And in last 24 hours, we had 1,448 COVID-19 deaths in one day, in 24 hours in the US. Obviously, it's a big source of worry as America heads toward COVID-19 death in 6 months long flu season. It's 6 months long. So, I mean, it's not 1 month, it's not 2 months, it's not 3 months, it's not 4 months, it's not 5 months, it's 6 months. You need two hands to show that it's 6 months, unless you have six fingers in one hand. I've heard some people have six fingers in one hand. I've never seen it, but who knows? As you know, I work at Virginia Hospital Center. Maybe I'll get to see it. You know, uh, one of the great things about working at Virginia's Hospital Center is you get to help people become better. You know, um, Meet their needs, and obviously, people have physical needs to be healthy because if you're sick, you have a lot of pain, and you can start losing your functions of your body. You know, like you can lose your vision, eyesight. You could become blind. So you know how you enjoy seeing your son and your daughter or your grandchildren. You like to see beautiful mountains and beautiful beaches. Um, you like to watch movies or TV shows, look at beautiful works of art, read a book, read my poetry books. You know, your eyesight gives you a lot of things that you like. I mean, you can drive because you have eyesight. If you don't have eyesight, you can't drive. And some people love driving. But as as we celebrate World Sight Day, I think it's important for us to think about what vision or sight or being able to see in COVID-19 America means. There's my hero, Kim Davis. In America, she was willing to go to prison to stand with Romans chapter 1. So she's my absolute hero in America. President Trump isn't my hero. Obviously, Joe Biden isn't a hero to many people. So, yeah, my hero is Kim Davis because she's willing to stand up for Christian faith and go to prison. That's my hero. And now you will have Christians who are willing to go to prison to follow the word of God as your heroes as well. As you know, I'm the independent candidate running for U.S. Congress in Virginia's 8th district, and I'm running under the platform Bring America Back to God. I believe that Christianity is the best thing for America for three reasons. Number one, majority of Americans are Christians. Over 300 million Americans are Christians. Majority of the black people are Christian. Majority of the Latinos are Christian. Maybe over 95% or 99% of Latinos are Christian. Majority of the white people are Christian. Majority of the Asian people are Christian. Majority of Native Americans are Christian. I mean, a lot of people are Christians. So over 300 million out of 330 million Americans are Christians. Southern Baptist Convention and Assemblies of God and Presbyterian Church America, they're trying to convert the other 30 to become Christians. So, hopefully we'll achieve that. And all 330 million Americans will be Christian. That'll be like the greatest thing to happen to America for 100% of the population to be Christian. because you go to heaven if you're a Christian, right? So, no other religion can offer that, going to eternal life in heaven. And obviously, Jesus says, I'm the way, the truth, and the life. No one comes to the Father except through me. That's why Baptist churches in Virginia, they spend money, effort, time, human resources to convert non-Christians to Christianity, right? So do United Methodists, so do Presbyterians, so do Nazarenes, so do Assemblies of God. They try to convert people who are not Christians to Christianity. They have different methods uh, to achieve that goal, but the goal is the same, right? And obviously, same with the Catholic Church, Archdiocese of DC, Diocese of Arlington. They want to convert you to Christianity if you're not Christian. Obviously, that's a very important thing. And obviously, Christianity came from Old Testament. Obviously, Christians believe that Old Testament is part of Christianity, and New Testament is part of Christianity. That Christians are the true inheritors of Old Testament, and that Jews, rabbinic Jews, people in the synagogue, they're the ones who went in the wrong direction. That's what Christians believe. The Christians are the true inheritors of the Old Testament. That Abraham is our father spiritually. And New Testament argues that vantage point. So for 2,000 years, Christians just have been supporting New Testament position. And I believe that America being distinctively Christian nation is a good thing for America, that it will make America better. It will make lives of Americans better. It will make America safer. And so my platform as a political candidate for US Congress in Virginia's 8th district is to bring America back to God, one nation under God. And obviously, God is not like some sacred cow. God that I'm talking about is God the Father, God the Son, God the Holy Spirit, the Holy Trinity. Um, yeah, I believe a lot of Christians will vote for me in Arlington, Alexandria Falls Church, and Fairfax County. Obviously, that's what they will do if they want to survive COVID-19, because I'm the Leonardo da Vinci of 21st century. And they know that I can provide the leadership they need to survive COVID-19. Today's big news was that vaccines will not be available to March. They're going to keep pushing back the numbers, the dates, obviously. So don't expect to see a working vaccine for several years. And when they come out, I mean, they may rush it, but it's not going to work. Um, I mean, I wouldn't take a vaccine that Joe Biden recommends or Trump recommends or Kamala Harris recommends or Vice President Pence recommends if it's rushed. I'm just not. I think it could damage your body and you could die from it or you could go blind from it if it's not properly tested, because side effects can kill you. Every drug has a side effect. You know that? At Virginia Hospital Center, we nurses, and as you know, I'm a registered nurse in the state of Virginia, and my license in Virginia is multi-state. So I can be registered nurse in Texas, Florida, North Carolina, South Carolina, West Virginia. I can work as a nurse in like over 30 states in America. And I'm working now at Virginia Hospital Center. So I hope, if you get sick, come to Virginia Hospital Center, you'll see me. A lot of people from Arlington have seen me at Virginia Hospital Center. It's really nice to see them. Um, and to serve them as a nurse. Obviously, I'm a nurse. I'm going to take care of you if you're my patient. So yeah, come to Virginia Hospital Center if you get sick or you have a surgery, elective surgery, like you need to operate on something. Yeah, I mean, it's a good hospital. People are really nice. It's a very clean hospital. It has a good reputation for being a good hospital. And people being nice. Um, but you know, you can, there are things that can go wrong in your body. And obviously, in the World Sight Day, we are focusing on eyesight. There are a lot of people who go blind. If you have diabetes, one of the maybe number one way Americans go blind is through diabetes. And as you can see under the screen, all diabetics are at risk of diabetic retinopathy. And look at the figures. I mean, you can go blind. If you have diabetes right now, one of the dangers that you have is that you can go blind. You must get your eye checked every year, at least once. Sometimes, you may have to you have to get eyes checked more than once. Um, that you must get your eyes checked. If you haven't gotten your eyes checked in 2020 because of COVID-19, go in, make an appointment, and get your eyes checked. It's very, very important. And Virginia Hospital Center network has ophthalmologists, eye experts. So you can get a referral from your doctor to see an expert at Virginia Hospital Center, medical offices, so make an appointment, come on over to Virginia Hospital Center. We have medical offices, including ophthalmologists, eye specialists. If you have diabetes, you need to get your eyes checked at least once a year. And Virginia Hospital Center's eye experts, ophthalmologists, can take good care of you. Make sure that you don't go blind or try to help you not to go blind. Sometimes the disease is so bad, you may already be on your way to becoming blind as a diabetic. So if you have diabetes, make sure you get your eyes checked. Just go to your doctor or call up your doctor and say, I want a referral to a specialist. I like to go to Virginia Hospital Center to see a specialist for eyes. So, just let them know. And then they can write a referral and you could come to Virginia Hospital Center and see an eye expert. And if your eyes are going blind and you may need surgery for your eyes, they'll arrange all that. But you need to come in and get your eyes checked. It's very important. If you have diabetes, you have to get that checked every year. And during COVID-19, maybe you didn't exercise as much as you should have. So your eyes may have gone damaged. You need to get an exercise bike and a walking treadmill. And if you have a big house, get a ping pong table. You have to get daily exercise if you have diabetes. It's important. And diabetes is a progressive illness, which means it gets worse and worse and worse every year. Even if you try hard to manage it, it gets worse. Some people it gets really worse. Some people it gets a little bit worse. Some people have their toes cut off because of diabetes. Some people have their foot cut off because of diabetes. Some people have their leg cut off because of diabetes. Then some people have their whole leg cut off because of diabetes. I have a good friend, John Kim, from my dad's church. My dad came to America, invited for to be a senior pastor of a big Korean church, First Korean Presbyterian Church of Philadelphia. And he pastored there all his life, once arriving in America to his retirement. And it became bigger and stronger as a church. A lot of Buddhists converted to Christianity. It's a Korean church, and majority of Koreans are Buddhists. And over 75% of the churchgoers were former Buddhists who converted to Christianity. So my dad's been doing a lot of missions among Korean ethnic groups in America to make sure they switch over from Buddhism to Christianity. And it's been very effective. So, as I said, like Baptist churches in Arlington, Alexander, Foster, Fairfax County, they're trying to convert Buddhists, Muslims, Hindus, you know, um, atheists to Christianity. That's their mission. So is Assemblies of God. They do all kinds of programs to try to convert you to Christianity. That's what my dad did, right? As a senior pastor of a evangelical church, Presbyterian church, and he targeted the Koreans and tried to convert them to Christianity from Buddhism. And that's what all ethnic groups do. There are Arabic churches in Arlington, Alexandria Falls, a church in Fairfax County, which are Christians. And maybe the pastor was a Muslim, became converted to Christianity. And his goal is to convert all the Muslims in Arlington, Alexandria Falls Church in Fairfax County who are Arabs, speaking Arabic, to Christianity. And there are churches of all ethnic groups in Virginia's 8th District, and the goal is to convert people, their ethnic group, to Christianity. That's what they do. There are Indian churches in Virginia's 8th District. We try to convert Hindus, Indian Muslims, Indian Buddhists to Christianity. They speak Hindi, or combination of Hindi and English at church. Um, yes, obviously the goal of the Christian church is to convert people to Christianity. And so I'm running under the platform, One Nation Under God. That's my political platform. And I invite you to align yourself with me, Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. Support my political platform to emphasize that United States of America is one nation under God. That's got the Father, got the Son, got the Holy Spirit. Yeah, I am proud to be Christian. I think Christianity is the best thing that happened to the world, not democracy. Because democracy has a lot of problems. The Pope doesn't like democracy. He condemns capitalism and democracy, right? The Pope of the Catholic Church. I mean, I don't go. Well, I mean, I understand where the Pope is coming from. Um, I mean, for me, I think United States under Jesus Christ will make democracy better. So without Jesus, democracy gets worse and worse. So I want to bring Jesus as the centerpiece of America's democracy. So join my platform. I'm not Republican. I'm not Democrat. I am independent. I may start a political party in the future if that's what God wants me to do. But currently, I'm just running as an independent candidate for U.S. Congress against Don Beyer, who's a Democrat. I'm an independent candidate right now, so you can vote for me on November 3rd, or in early ballot, or in absentee ballot. I've sued Virginia Governor Northam and Virginia Department of Election to put my name on the ballot. Uh, you know, Governor Northam is Democrat, so he's trying to block my name out of the ballot box. He's playing dirty. And Virginia Department of Election, they don't have the legal authority to, you know, grant me a waiver for the 1,000 signatures that I needed to submit by June 9th. I needed to go door to door with my volunteers to collect 1,000 signatures. But as you know, Governor Northam shut down Virginia from March 30th to June 10th. And I had to submit the signatures by June 9th. So, that's why I wanted a waiver. And Governor Northam is like Democrat, is playing dirty politics. He's not going to give me a waiver. So I went to the courts on June 3rd to get my name on the Virginia ballot. So it's in the court system, but because of COVID-19, everything is slowed down. So just write my name in until the court rules in my favor and put my name on the ballot. Just write my name, Heerak Christian Kim, on the absentee ballot for Virginia State District. And for early voting, if you go in to vote early in Fairfax County, Arlington County, City of Alexandria, Falls Church, just vote, write my name in. Yeah, I mean, I will help you with COVID. There's a lot of corruption in Washington, D.C. in both Democratic Party and Republican Party. That's why you haven't gotten your stimulus checks yet, because Pelosi is corrupt. But the Republicans are not really trying to get you the stimulus checks either. I mean, if I'm there, that would be my priority, because I know how much American citizens are hurting. And we need to get the stimulus checks out to American citizens. So that'll be my number one priority right now. But unfortunately, it's not the number one priority for Pelosi. She has all these liberal agendas, and she doesn't care if you don't get your stimulus check, because she has like liberal agenda. She has like liberal wish list, and she doesn't care if your family suffers not getting a stimulus check, because she's not going to give you a stimulus check until like all her liberal things are like fulfilled. I mean, that's not loving Americans, right? I don't consider that love. I mean, would you let your daughter starve or your son starve when they're hungry and they need money because you have all this wish list to fulfill? I mean, you make sure they get the food first. I mean, Maslow's hierarchy of needs is physiological need is the most important. Your need for food, shelter, paying rent, getting food, buying food, that's the most important thing for me, right? In terms of COVID-19 relief. Vaccines are not going to save you today from hunger, from being kicked out of your home, right? Stimulus check will. So that's why I would prioritize that. Unfortunately, President Trump is not prioritizing that either. And it's sad. I mean, that's why I need to go to Washington, D.C., prioritize you and your children and your needs. Because Republicans are not prioritizing your needs. Democrats and Joe Biden, Kamala Harris, did they talk about stimulus? Did they really, are they interested in getting you the stimulus checks? They don't really care about you. But Heerak cares about you. Yeah. And Heerak cares about your eyesight. Diabetes can get you blind. Obviously, I was talking about my friend John Kim from my dad's church. His father had diabetes, and his father got his leg amputated, and then his father died like 6 months later. Yeah. Um, if you don't manage your diabetes, I mean, you may die before you go to blind. I mean, there are so many ways to die from diabetes. It's not even funny. So if you have diabetes, you need to see several specialists every year. You have to see them constantly, and that's eye specialist, your foot specialist, because foot specialists can monitor your feet to make sure you won't need to cut off your toes or your foot. You have to manage your diabetes. I mean, so you ask your doctor to write you a referral to Virginia Hospital Center. We have a lot of experts in the medical offices who can take care of you. We have podiatrists, the foot specialist in the medical offices. So you ask your doctor to write you, referral. Um, or if you have an insurance which allows you to go directly to a specialist, just walk into Virginia Hospital Center. Um, yeah. Um, Coronavirus can also make you blind. There are people who have gone blind because of coronavirus. Because when your eyes get infected from COVID, it starts to infect your eyeball. You see that in the center? That's why people wear goggles, right? Because COVID-19 can enter your eyeball and infect your eyes and you feel blind. I mean, it's not as common as breathing in because, somebody has to like spit into your eye. But I mean, people could you know, talk to you and, COVID-19 can travel to your eyes, it's possible. I mean, your eyes doesn't breathe in, right? Like when you talk, you breathe in through your mouth. When your nose constantly breathe in. So it's easy for COVID-19 to travel into your nose and your mouth. Your eyes don't breathe anything in. So it's harder, but still it can go in there. Um, yeah, so take care of your eyes. Make sure you visit your eye doctor. Get a referral. And you need to get examined if you have diabetes. Yeah, you don't want to go blind like in the next 6 months from some problem in your eye. Get it checked now because it's going to get worse. 6 months of COVID-19, it's going to get worse. Like if you're like, oh, I go November, you may not be able to go in November. Everything may shut down in November. So go now, like this week, to get your eye checked. You know, um, yeah, make an appointment now. After you see the show, or stop the show for a little bit. And then make the call to make your eye appointment, then continue seeing it again. You can always call up Virginia Hospital Center and say, I want to go see an eye specialist. What do I have to do? Just call the operator, and then they could point you as well. Now, United States have 1,448 people who have died in 24 hours. So, death is spiking. Eventually, we may have like 10,000 people die per day, 20, 30,000 people die per day. Flu season is 6 months long. That's like not 1 month, not 2 months, not 3 months, not 4 months, not 5 months. It's 6 months. You need both hands to calculate that. So I'm predicting minimum 3 million Americans will die. It only takes 60,000 people dying per state to have 3 million people in America die. Yeah, a lot of people are going to die from COVID-19 in America. We're only getting started. This is only October. We have until May. Yeah, until next May, we're going to be dying. You're listening to nice Israeli songs. Do you like it? As you know, I lived over 3 years in Israel. I'm fluent in modern Hebrew. I can read the Hebrew Bible, Old Testament in Hebrew. I love Israel. I have a lot of friends there. Yeah, three of the most wonderful years of my life living in Israel. Although buses are blowing up everywhere because of the terrorists, but I mean, world isn't perfect. You, you will always have bad with the good. Yeah. Anyway, so confirmed cases is 7,586,904 in America right now. Obviously, you can go up to like 100 million people with confirmed cases by May. That's possible. I mean, it depends on how much people get together. Like in Halloween, if people are going door to door trick or treating, I mean, we may see a big jump in the cases, big jump in the death. And we're talking about 50 states. Cumulatively, you could have a tremendous number of cases of death after Halloween. That's October 31st. November could be the month of death because of all the Halloween parties and trick-or-treating. Yeah, a lot of children can die. Death is, I would not take my child to trick-or-treating if I were you. I would recommend like Arlington County, Alexandria City, Falls Church, and Fairfax County illegalize trick-or-treating to protect the lives of the children. Yeah, because after they're infected and die, it's too late. You see what I'm saying? I mean, do you want to wait until they get infected and die to legalize trick-or-treating for next year? How does that help residents of Arlington County, Alexandria, Falls Church, and Fairfax County in this flu season? You know what I'm saying? It's better to prevent that before it happens than like reassess your policy after people die. You see what I'm saying? Preventative medicine is far more important. Preventative, like primary nursing care is better. Preventing disease is better. I mean, do you want to go blind and then try to manage your blindness, or do you not want to go blind? Right? I think it's better that you don't go blind. That's what I'm saying. Call your eye doctor or call Virginia Hospital Center and make an appointment to see one of the eye specialists, with your insurance. Um, yeah, I mean, there are other eye doctors in there, yeah. I mean, but you need to go see an eye specialist if you have diabetes. And if you have COVID-19, make sure you come to a hospital, like Virginia Hospital Center is great. Because you don't want to go blind. And if you have symptoms, come into Virginia's hospital center. If you don't have anything, great, but get tested. If you have symptoms like fever and coughing and you don't taste your food, I mean, your eyes may be infected, you just don't know. Yeah. I mean, dying is a bad thing, but you could survive COVID and still go blind. See what I'm saying? It's possible. Um, and you don't want to go blind. There are people who've been paralyzed from COVID. COVID-19 is a crazy virus. It does all kinds of stuff. Gives stroke in 20-year-olds, who generally don't have stroke. It's a weird virus. That's why I'm saying there's going to be no vaccine for at least 10 years, at least. Um, and people are going to die this flu season. People will die in the next flu season. It's going to keep continuing. It's like AIDS virus or HIV virus. There's no vaccine, and hundreds of thousands of people die every year. You know, you may not hear about it because you didn't die, but hundreds of thousands do die every year. Um, Now, Middle East, top five COVID-19 cases. Iran is number one, and they have 6% death rate, 488,236 cases, far lower than Florida, Texas, and California. The death rate is 6%, and the number of deaths is 27,888. Iraq is number two. Its death rate is significantly lower at 2%. Numbers of infections are close to Iran. 394,566, 9,683 have died. And it's like 9 days in America. Saudi Arabia is number three with 338,132 cases, 1% death rate. 4,972 people have died. But the real worry is Israel. Yeah, Israel is a real worry. You know why? The death rate was 0.6% or lower. Now look, even after the country shut down completely, it's the first country in the world to shut down the whole country before Jewish New Year, Rosh Hashanah, a couple of weeks ago. But their death rate is rising, even though the whole country is shut down. Can you imagine if they didn't shut down, what would have happened? So their death rate went up from 0.6% to 0.7%. Cases are increasing and death rate is increasing. Yeah, a lot of people have died. Percentage-wise, very high. So Israel may be expecting a lot of death, you know. Um, I mean, obviously, COVID-19 can kill 25% of Israel, like Jews, 25% of the Jewish population in Israel, or Palestinian population in Israel, that's possible. Yeah, if you live in Israel, you should worry because what Intifada and Palestinian terrorism hasn't achieved, COVID-19 may achieve. You know, what's going to happen if 1/4 of Israel dies? And that's 1/4 of Israeli army. That's 1/4 of Israeli economy. I mean, the nation will may collapse. And Israel still have enemy nations who may invade it. What's going to happen? You know, there are trickle effects. There are domino effects for everything. So it's not just about 2020, 2021. What's going to happen to Israel in 2022, 2023, if 1/4 of the nation dies? Israel shut down and their death rate is going up. Israel shut down completely and death rate is going up. What's going to happen in the next 6 months? We don't know. We don't know. It's possible 1/4 of Israel may die. It could be higher than that, actually. That's why I'm playing Israeli song, you know, because you know I have a soft spot for Israel, and it looks like Israel may have massive death. Maybe even 25% of Israel may die this flu season. You know, don't be surprised if there are more than one country that have 25% of the population dying. You shouldn't be surprised. It's a global pandemic. You know, 25% of New York City can die in the next 6 months. It's a global pandemic. COVID-19 is a killer virus. Don't doubt it. The possibility is science. We're just talking about science here. Species do go extinct. I don't know if you study environment. You know, I support like the World Wildlife Federation Fund. You know, and there are animals that go extinct. There, even when there are animals that used to be like millions, they go extinct. It happens, you know. So don't think like 1/4 of New York cannot die from COVID. It can. Yeah, it's the tragedy of environmental science shows species go extinct all the time. And even if the species don't go extinct, certain areas have that species go completely extinct. And that could be like New York or, you know, Israel or any other country, you know. But Israel is a worry because it's out of all the Muslim, all the Middle East countries, Israel has the greatest spike in death in terms of percentage wise. That's why I'm playing the Israeli music because it looks like a lot of Israelis will die. That's the sad thing. Anyway, Qatar is number 5 with 127,394 cases. Death rate is 0.2%. 218 people have died. So Qatar, there's like nobody dying, really. And unlike Israel, where the death rate is sharply, exponentially growing. You know, Brazil only had like 1,000 deaths before, a few months ago. Now it has like over 100,000. The United States had like what, less than 10,000 in April 2nd. Now it has like what, 212,000. Things can happen really quickly. Yeah. Uh, yeah, New York must worry because it's a very crowded place. A lot of people can die. I don't believe the liberal media who make it sound like COVID-19 isn't that serious. It's a lie. It is serious. You know, we have 6 months of flu season. Death rate can exponentially grow. As I said, Israel shut down completely and their death rate is sharply growing. And that's what happened to New York in April. New York City was completely shut down and then 30,000 people died while it was completely shut down. Yeah. I march for your life. Right? Shutting down your city is the right thing to do. I think New York City should shut down completely until they flatten the curve. If they don't, they could have over 1 million die just in the city itself, New York. I mean, if you live in New York City and you have money, you're a millionaire, billionaire, move out of New York City for 6 months of flu season. You don't need to be there to die. You can't take your money with you. Yeah, so Utah is a area that's shockingly become a crisis area, and 6 months of flu season is ahead. And you don't know, maybe 25% of Utah residents may die in the 6 months. We're going to have some states possibly with more than 25% of the population dying. It's possible. Don't think that it's not possible. It's possible. Um, 6 months long. It's a long time. Um, so my question is, as we know, Utah has a lot of Mormons. So my question for today is COVID-19 America, will Utah see massive COVID-19 death among Mormons? First article is Utah healthcare systems starting to feel COVID-19 strain as state sees record 1,501 cases Thursday. It's less than what we have in Virginia, but you know, it's something new for Utah. Uh, yeah, I mean, and we got a lot of death in Virginia too, obviously, but we're focusing on Utah now. Every city, I'm saying 3 million Americans are going to die. That's like 60,000 deaths in every state. So obviously, Utah's going to have at least 60,000 dying. Um, Healthcare systems feel it, you know. As you said, as I said, at least 12 nurses are going to die in Virginia Hospital Center where I work. At least 12 hospital nurses are going to die in Innova Fairfax Hospital. At least 12 nurses are going to die in Innova Alexandria Hospital. At least 12 nurses are going to die in MedStar Georgetown Hospital. In 6 months of flu season, you're going to have at least 12 nurses die. It's not like 1 month of April, you know? And it didn't really affect us because it was mostly in New York. I mean, I was talking to the chief nursing officer, CNO of Georgetown, MedStar Georgetown Hospital, which is our group. My CNL 2020 group, we worked with the chief nursing officer of MedStar Georgetown Hospital. So, you know, she knows me. She knows my group members. We worked together with her in the summer of 2020. And we made several proposals to her. We said there needs to be a hazard pay for nurses during COVID-19 season, you know, to motivate nurses. This is demoralizing with all the COVID-19. Um, so that's one thing we proposed for the RN residency program at MedStar, to give everybody a hazard bonus as a way to, you know, it doesn't have to be a lot of money, but just a little bit higher, like, and it's identified as hazard bonus to show them that we appreciate them. So, so you know, we made a couple proposals to the RN residency program at Georgetown as part of our clinical nurse leader practicum, our capstone project. What was our capstone project? So our capstone project as clinical nurse leaders in our group, it was a group capstone project, was to improve MedStar Georgetown Hospital and its residency, RN residency program. So we came up with a couple proposals, and you know, we were assigned the Georgetown MedStar Hospital. I think because I'm in it, you know, it was my group, and everybody knows that I'm the Leonardo da Vinci of 21st century. So everybody wants to know what I believe and my thing, my expert opinions, as well as my research and my assessment. So I think that's why the director of Georgetown University Clinical Nurse Leader assigned the chief nursing officer to our group as our capstone project, because obviously it's like free consulting, right? I mean, you know, that like what we come up with is consulting advice for MedStar Georgetown Hospital's RN residency program to improve them, right? And that's our capstone project. So they get like, they would have to pay like what, 50,000, 100,000, maybe million for this kind of research and professional consulting. We're all clinical nurse leaders now, so we are professionals, obviously. But you know, it was our capstone project, so we interviewed the chief nursing officer of MedStar Georgetown Hospital over Zoom. And then we prepared materials and proposals for MedStar Georgetown Hospital to improve their registered nurse RN residency program for new graduates. So, Chief Nursing Officer shared with us, what the RN residency program at Georgetown MedStar Hospital is like, what they did during COVID-19 in April and May and March. And she told us that no, not one nurse resident died. And I think that's a good achievement. But it was, as I said, I didn't say this to her. I don't want to offend her, But what I was thinking at the time was, well, the crisis of COVID-19 really did not hit Virginia that hard in the first flu season. It was mostly in New York and New Jersey. It kind of came to Philadelphia, Pennsylvania, but it didn't really hit DC that hard. But this time it's going to be different. It's going to hit DC very, very hard. Um, so I don't think, I think I'm willing to bet her, if she wants to bet me, the chief nursing officer at MedStar Georgetown Hospital, that at least 12 nurses will die by Christmas. Because I'm like 100% sure that's going to happen. I mean, not 100%, 99.9% sure. Because we have this is a killer virus now that it's like everywhere in Virginia, everywhere in Maryland, everywhere in DC. People are going to die. I mean, most people who work at MedStar Georgetown Hospital live in Virginia or Maryland. Some live in DC, but and Fairfax County is having like the most number of new cases of COVID. Every day. It's either like Fairfax County or Prince William County. I mean, so like tens of thousands will die in Fairfax County. You know that, it's like expected. They work at like Georgetown Metro Hospital. So it's expected. So I'm willing to bet the chief nursing officer of MedStar Georgetown Hospital, for whom our group at Clinical Nurse Leader did a capstone project for our Masters in Clinical Nurse Leader, that minimum 12 nurses will die by Christmas 2020 at Georgetown MedStar Hospital. Probably a lot of them will be, residents, RN residents, because RN residents make a lot of mistakes because they're learning, Yeah, so I mean, and Children's National Hospital will have minimum 12 nurses die. George Washington University will have minimum 12 nurses die. Sibley Hospital will have minimum 12 nurses die. Washington Hospital Center will, MedStar Washington Hospital Center have minimum 12 nurses die. Every hospital in this area have minimum 12 nurses die by Christmas. And that's just the nurses. I'm not counting the techs, respiratory therapists, medical doctors, surgeons, and anesthesiologists. I'm not counting that. I'm just counting nurses, RN nurses. Yeah, so it's going to be horrific. And I'm, predicting that at least 5% of our clinical nurse leader core members will die. That's 5 out of 25. So I'm going to cheer for them. My core members. CNL 2020, yay! We graduated from Georgetown after 2 years of hell. And we are going to plunge into hell to help a lot of people during COVID-19 flu season, 6 months long. Some of us will die. Some of us will die. Some CNL will die. But at least you have your master's in clinical nurse leader degree from Georgetown. You are a Hoya. You will die as a Hoya. Yay! I'm not yay. I don't know what to say to that. But, at least go write that in your graveyard. Died as a Hoya with a Hoya degree. Master's in clinical nurse leader. Yeah, 2020. Yeah, but in seriousness, you can expect people to die. Like, it's a killer virus. It's a global pandemic. The significant quote from Jacob Klopfenstein's article is Utah's number of COVID-19 cases have increased by 1,501 on Thursday. That's today. A new record number of cases in a single day. I mean, every state is like breaking records now. 5 deaths were also reported. It sounds small, but it's like a little spark that gets the fire going. You'll start seeing tons of deaths in the near future. According to Utah Department of Health, as Utah continues struggling to contain a spike, it's not going to be able to contain it. It's impossible. You can reduce the spike to a smaller curve, but it's impossible to flatten the curve. We know that because we closed down America and we couldn't flatten the curve. So yeah, you could like try, but you're not going to be able to flatten the curve. You could reduce the curve, like from like this, like from 1 million death to like 200,000 death. As Utah continues struggling to contain a spike in cases of the disease, Governor Gary Herbert encouraged Utahns to stay the course. Yeah. What course is that? I don't know. Like sometimes politicians talk, jabber, 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 and they don't make any sense. What course is that? You know? I mean, of course, the head to death. Um, Second article, and you see the beautiful Mormon Tabernacle, and I love listening to the Mormon Tabernacle choir. They're like the best choir in the world. And that's like the Saint Peter's in Rome for Catholics. That's like the Mormon temple in Utah. Isn't that beautiful? Jeez, with the mountain in the background. Man, these Mormons know how to live. Um, and that's the spirit team for Brigham Young University. Underneath that, some of these Mormon women are beautiful. I tried to convert a couple of Mormon missionaries when I was in Delaware. They're two beautiful Mormon missionaries. They're really pretty. They tried to convert me to Mormonism. I tried to convert them to Christianity. But yeah, they're really pretty. Like Mormons do 2 years of missions. So they were doing their 2 years of missions in Delaware. And Mitt Romney is a Mormon, as you know, and he became a senator in Utah. Um, yeah, Brigham Young University, it's supposed to be a pretty nice university. So one of my professors did her PhD from Utah. I really like her, Professor Emma. I really like her. She's a really nice professor. She works at National Institute for Health on genetics. So what she's researching may save your life. Um, the second article is amid surge, Brigham Young University says COVID-19 cases on campus are declining. Well, it's too early to say because our flu season is just getting started. Mackenzie Stauffer on KUTV2 CBS. According to the university's coronavirus dashboard, there are 158 active cases at Brigham Young University, which equates to 0.37% of the campus community. Yeah, but it quickly spirals out of control. That's why one person can infect 1,000 people. I mean, anybody who studied pandemics know that. A total of 1,440 people are no longer in isolation because of the virus, which means 1,140 440 people were in isolation, right? I mean, it's going to keep spreading. What are you going to do? Keep putting people in isolation? Prisons show that COVID-19 spreads like wildfire in prisons. Well, we're going to try to emulate the prison system in your university. Yeah, I mean, this is why I worked hard for 3 months to shut Georgetown University down, to protect lives of students, professors, staff, and townspeople from COVID-19 death. That's what Brigham Young University should have done. They should have gone 100% online. It's a big mistake that they made. And Brigham Young University may become the vector that ends up killing hundreds of thousands of Utah people. It's sad. As you know, from the very beginning, I championed shutting down all campuses, go 100% online. You have the technology to do that. When you want to save lives, let's use the technology to save lives. But unfortunately, people don't listen. That's the problem, right? You have the technology to save lives, but people don't use it. Why? Why? Llama, llama, llama. I'm not talking about Dalai Lama. Lama in Hebrew means why. Why? Llama, llama. Yeah, but yeah, United States is headed to COVID-19 death. All the COVID-19 are like high-fiving each other. Yay, the colleges are open. We're COVID-19. We're going to have a COVID-19 party. That's what COVID-19 is saying right now. Because colleges are open. I mean, COVID-19 spreads from people to people, right? It spreads from people to people. You get people together, you're going to that COVID-19 spread. I mean, geez, it's just like simple logic here. 1 + 1 is 2. It's like first grade math. Yeah, it's highly unfortunate. Yeah, I don't believe in the liberal media who says like COVID-19 is harmless, that vaccines are going to work. Media was saying vaccines going to come out by October. Where's the vaccine? Where is the vaccine? You see what I'm saying? See, I don't lie to you. Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District. I knew there would be no vaccine in October because science is science. Just like you can't hurry love, you can't hurry science. Well, I guess you can hurry love because Elvis and so the French are trying to butt into my show. But yeah, but I like the French. I love Paris. I wish I could be in Europe now, in Paris, walking around, eating French food. Oh, French food is so good, especially like desserts. Croissant. Oh my gosh, French croissant is amazing. In Israel, my favorite food item was shawarma. It's like, you can get shawarma actually in Arlington. I mean, I see that in Columbia Pike because they're Palestinians and Israelis, and so they sell shawarma. It's not as authentic though. I don't know. Something changes. But yeah, shawarma was so great in Israel with zhug. Zhug is like a spicy thing that you put in there. Oh my God, just you sweat to death, but tastes so good. You know how it is like when you eat spicy food, you're sweating and you're like half dying and drinking like soda after soda, but you still like it, you go for more. I love spicy food. I'm Korean. Korean food is very spicy. So I like spicy food from Mexico. I like spicy food from Israel, like zhug on my shawarma. Yeah, on a pita bread. Yeah. Anyway, oh, I'm feeling hungry for a shawarma. But anyway, yeah, um, yeah. I mean, you need to be careful because death is coming. Minimum 3 million Americans will die. I believe that there will be far more because COVID-19 spreads through people. We have technology to shut down. We should shut down, right? But you gotta blame the local leaders, right? Because different areas are different. I think Mayor de Blasio is doing the right thing, shutting down areas, but I don't think he's doing enough. I think he should shut down all of New York until there's a flattening of the curve. Because if it starts spreading, even if it's small, if it starts spreading, it's going to exponentially spread, right? That's what it's showing, that they're heading toward exponential spread. So you gotta shut everything down. Yeah, you don't want to shut everything down, but do you want to die? I mean, you know what I'm saying? You gotta like shutting everything down, which is now no fun, but dying, that's worse. I mean, geez, don't you want to have like 3 months of going to the beach next summer 2021? Even if there is COVID, you can still go to the beach. It's safe in the beach. It's like open air. There's no ceiling. There's no walls, right? This summer in 2020, I told you to go to the beach and have fun. Hope you listen. Don't you want to survive COVID enough to go and enjoy the fun in the sun, in the beach next summer? Yeah, in order to do that, you gotta shut down completely. You gotta go into hibernation mode. Well, you're not gonna survive COVID. You're not gonna see another bikini, until your death. I mean, maybe your wife could wear a bikini for you, but you're not gonna see another beach. Yeah, if you don't survive COVID. Um, yeah, as you know, this is a daily show. So check in tomorrow. I'll give you more information. But if you're in Utah, you should worry. You're headed toward massive death. I like Mormons. I have to tell you, I like Mormons. They're clean people. They don't do drugs. They don't drink alcohol. They don't do drugs or smoke. I mean, these are clean people. I like Mormons. But unfortunately, like a lot of these clean Mormons may die because COVID-19. It's a horrible virus, killer virus, and it's spreading like wildfire in Utah right now. Yeah, and it's going to get worse, and it's going to get exponentially worse for the next 6 months. Yeah, it's going to be bad. Yeah. So I feel for you, Utah. I mean, you may lose like 20% of your population by May. Especially Brigham Young University doesn't shut down completely. like not just Brigham Young, but University of Utah and other universities and schools in Utah. Yeah, I mean, you may lose 20% of your population by May. Anyway, yeah, check in tomorrow. Watch this show. If you have relatives or friends in Utah, tell them to watch this episode. Maybe we'll get them thinking about things so that they could avert massive death. I mean, some people will die because it's COVID-19, but we could reduce the death, right? That's what we're aiming for. Yeah, it's kind of like reducing pain. If your pain level is 10 out of 10, it's it's difficult to go to 0 from 10, but you try to go to like 5 out of 10. You know what I mean? Same with death. I mean, if you're gonna have like a million people die, it's impossible to go to 0 death, but maybe you go to like 100,000 death, you know? But it's a big achievement because 900,000 people didn't die. You know, you see what I'm saying? So right now we're at the damage control mode, reducing the death mode. There's no way you're going to prevent death now in any of the states or any of the cities. You're not going to prevent death. Like, you're not going to go to 0 death, but you could go from like million death to like 200,000 death. You see what I'm saying? And that's where New York is. If they don't shut down completely, they could have 2 million people die, you know? Yeah, it's about reducing death numbers. There's a 6 months long flu season. It's going to be daily death, just like spiking and spiking and spiking. What are you going to do? What are you going to do? You're like mere mortal. You can't stop it. What are you going to do? How are you going to manage that? Yeah, that's coming. Yeah, so check back with this show and let your relatives, friends, coworkers, people you know in Utah know so they can watch this show. Now, bring you more important facts and truth that you need to survive COVID-19. I want you to survive. I want your child to survive. That's why I created this show on April 2nd, 2020. So check back tomorrow as well. It's a daily show. I look forward to seeing you tomorrow. Bye.